Are you suffering from cancer? আপনার বাড়ির কারুর কি ক্যান্সার হয়েছে? Is any of your relatives or friends suffering from cancer? No. Today I am not going to tell you or discuss anything about cancer. Rather, a more important topic, which doctor to consult. Hello friends, this is Dr. ARGHYA BASU, Gastro and Cancer Surgeon, welcoming you all to a very interesting episode of your own YouTube channel ARGHYA, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance even at personal level. See, there are two types of medical systems in our country. One is MCI recognized and the other is recognized by MOHFW, Ministry of Health and Family Welfare, related to Government of India. Now suppose some of your patients known to or relatives or friends is suffering from cancer. You are going to visit a oncologist. अभी तक oncologist ये term के साथ सब लोग जाने पहचाने हो गया है कि कैंसर हुआ है तो I have to see one oncologist. But there are different kinds of oncologists available in the market. Radiation oncologists, medical oncologists, surgical oncologists, clinical oncologists. तो आप कौन सा oncologist के पास जाएंगे? Here lies my answer. I am not going into MBBS because that is the basic qualification. In our country, n number of government and private institutions are currently undertaking this course of MBBS. Now, cancer or oncology is a specialized subject. It requires detailed knowledge of three subjects. We have three weapons in our hands when we are dealing with cancer. Number one is surgery, number two is chemotherapy, and third is radiation therapy. Now, one cancer specialist has to be conversant with all these three techniques to be a good cancer specialist. Now, when does this specialization comes? MD in radiation oncology is a specialization subject equivalent to master degree. There is another degree called DNB in radiation oncology as well. Now, here comes the fact that I was talking about two systems in our country. One is MD-MS, post-graduation level, followed by DM or MCH in super specialization level, which is given by MCI. The second system is DNB or Diplomat of National Board, which is given by Ministry of Health and Family Welfare of Government of India, which is run in most private institutions and some of government institutions. It is like DNB in general surgery, followed by super specialization in DNB in surgical oncology, or DNB in general medicine followed by DNB in cancer medicine or medical oncology, which becomes a super specialization. Now, medical oncology and surgical oncology, these two are super specialization subjects, whereas radiation oncology is actually a specialization subject, which is at par with master's degree. Now, in most of these institutions, which are cancer centers, there are these three types of doctors are existing at the same time who treat the patient like a team. Now you will say MD is better or DNB is better, DM is better or DNB super specialization of better. It is not like that. As per rules of Government of India, DM and DNB super speciality are just equivalent. MDMS and DNB specialization is just equivalent. So, a DM in medical oncology and a DNB in medical oncology are at par. Government of India has given this power to our medical oncologists. At the same time, MCH in surgical oncology and DNB in surgical oncology are equivalent. Government of India has given this power to both these types of doctors. They can treat or perform any kind of cancer surgeries. They have same powers as per the rules of Government of India. But radiotherapy or radiation oncology is a post-graduation subject, which is MD radiation oncology or DNB in radiation oncology. Both these are equivalents, but these are post-graduation level subjects, whereas DNB super specialty or DM or MCH are actually super specialization subjects. Now, where you live, in that locality, you find a doctor who claims to be an oncologist, but you don't know his or her degree. What will you do then? Please listen to the video till the very end so that you don't miss any vital point, and at last where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई बेनिफिट मिल रहा है तो प्लीज़ ये चैनल को सब्सक्राइब कर लीजिए एंड बेल आइकॉन को प्रेस कर दीजिए so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now without any further delay, let's dive deep into the problem and how we are going to tackle it. Now let me be very clear on this thing that I am talking on a allopathic system of medicine, because there are numerous other alternative systems of medicines available in our country, like Ayurveda, like Unani, like homeopath, this type of other alternate systems of medicines who also claim that they can cure cancer. I am not going into that controversies. I will keep my discussions limited only within the constraints of allopathic system of medicine. Now let's come to back to our fact. We are having a cancer patient. Which doctor should we go? Now the thing is, in institutes which have national and international repute on cancer, like TMH Mumbai, like AIMS, like CMC Vellore, like any government regional cancer center, all these centers have a multidisciplinary tumor board. So what is a tumor board? A tumor board consists of different kind of doctors, not only oncologists, but it also involves cancer care nurses, it also involves cancer care physiotherapists, cancer care psychiatrists, so on and so forth, so that a team of 8 to 9 or more than that people can come to a conclusion unanimously that whether we should treat the patient by giving chemotherapy first, or radiation first, or surgery first, or chemotherapy after surgery, or radiation after surgery, likely. Now the thing is, see, when a person is studying radiation therapy, he or she is mostly studying radiation therapy, how to deliver radiation. Radiation is a machine oriented subject. It is related to machine learning and physics, radiation physics. So a radiation oncologist is more conversant with how to deliver radiation, how many fractions to be given, whether the radiation is to be given beforehand or afterhand, like that. Next, I am coming to medical oncology. A medical oncologist is a doctor who has specialization in general medicine and then super specialization in chemotherapies. So a medical oncologist usually gives chemotherapies. So when can we give chemotherapy? We can give chemotherapy upfront. That means at the starting of treatment, which is called neoadjuvant chemotherapy. We can give chemotherapy after performing surgery, which is called adjuvant chemotherapy. Even we can give chemotherapy in palliative settings also. That means the cancer is in stage 4, it has spread to all the systems or all the organs of the body. The patient has a limited lifespan, but he is not going to die tomorrow. So, and for the rest of his or her days, we have to give him or her at least some form of cancer therapy so that he or she can have a productive life. So this is called palliative chemotherapy. So palliative chemotherapy is also decided by medical oncologist. And lastly comes the role of a surgical oncologist or a oncosurgeon or cancer surgeon. Now a cancer surgeon decides on how to cut the cancer, where to cut, when to cut, and when not to cut. The most important thing that you need to treat cancer is surgery. Surgery and surgery. Surgery is the most important tool if you need to eradicate cancer from a patient's body in most of the cases. Like in case of blood cancer, there is very limited role of oncosurgery or cancer surgery, and that is also dealt by mostly hemato-oncologists, not by other kind of oncologists. In case of blood cancer, you have to see a hemato-oncologist and a hemato-oncologist only. There is very limited role of other oncologists. Now see, a surgeon first sees the patient, he decides whether I can cut this cancer or I cannot. If the cancer is very large, it is locally advanced, I cannot cut the cancer completely. And if I cannot take out 100% of cancer, then there is no point in cutting. So, I will be utilizing neoadjuvant chemotherapy, and I will call my medical oncologist friend to give neoadjuvant chemotherapy to that patient, so that I can downgrade and downsize the tumor, and then when the tumor shrinks to a better size, I can cut the tumor and I can remove the tumor completely. Now, a cancer surgeon or a surgical oncologist is a doctor who decides on when to cut, how to cut, and when not to cut. In most of the centers of national and international repute, a tumor board consists of many doctors, but likely the ultimate call is taken by a surgical oncologist or a cancer surgeon who decides that, see man, I can cut this patient, so I will cut first. If I cannot cut this patient, I will call upon my medical oncologist fellow, or I will call upon my radiation oncologist fellow to give neoadjuvant chemotherapy or neoadjuvant radiotherapy. But if you directly go to a radiation oncologist doctor, he or she may not have the adequate knowledge about whether the cancer is operable or not operable. So, invariably, he or she will have to take opinion of his or her surgical oncologist friend. At the same time, if you go to a medical oncologist, the medical oncologist will mostly concentrate on chemotherapies, and he will try to give some chemotherapies initially. That is, to some extent, I will say that it is helpful, because in almost all types of cancers, the role of neoadjuvant chemotherapy is coming up very brightly. It is seen that in most of the cancers, if we give some form of neoadjuvant chemotherapy at upfront or first, then the cancer downgrades and downsizes, shrinks to a normal size, where the life of cancer surgeon becomes a cakewalk. So, I will prefer that if no other oncologists are available, you should take your patient to a surgical oncologist first. But before going to a surgical oncologist, please go through the degrees of that concerned surgical oncologist, because India is such a country where, due to deficiency and dearth of surgical oncologists with a super specialization degree, most of the cancer surgeries are still now performed by general surgeons, general gynecologists, general ENT surgeons, or maxillofacial surgeons who lack some kind of exposure to neoadjuvant chemotherapy, neoadjuvant radiotherapy, and other form of neoadjuvant treatment. So, whenever you are going to a surgical oncologist, please go through his or her degrees and take your reviews from the Google, take your reviews from other patient parties, and internet. If all of us have internet in our smartphones at the tip of our hands, so go through Google, please search regarding the reviews of the doctors and then visit a surgical oncologist. Now see, अभी तो ऐसा जमाना आ गया है, लोग फाइमोसिस ऑपरेशन करने के लिए भी यूरोलॉजिस्ट के पास जाते हैं. कार्पल टनल डिकम्प्रेशन, इट्स ए माइनॉरिटी, उसके लिए भी न्यूरोसर्जन के पास जाते हैं. और क्रॉनिक नॉन हीलिंग अल्सर, छोटा मोटा अल्सर जिसको एक्सरसाइज करने से ही ठीक हो सकता है, उसका भी ट्रीटमेंट करने के लिए आप पेशेंट विल गो टू ए प्लास्टिक सर्जन. सो वी हैव मूव्ड टू ए हाईली स्पेशलाइज्ड एरिया ऑफ मेडिसिन. सो व्हाई should we compromise in case of cancer? If you are having cancer or it is diagnosed, go to a surgical oncologist. Or if a surgical oncologist is not available, you go to a medical oncologist. He or she might be knowing a few surgical oncologists. You can go to a radiation oncologist who is definitely having some sort of connection to a surgical oncologist. They will guide you. But please go to a cancer center, a cancer specialist who is renowned, and treat a cancer the way a cancer should be treated. Don't neglect or don't play with cancer. Cancer is such a thing that if you can treat the disease correctly up to stage 3, it can be totally cured. but it is not cured in our country because of delay or taking n number of opinions from n number of doctors, n number of relatives, n number of friends, like that. So don't delay. If you are having cancer, go to a cancer specialist who is having specialized super specialization degrees in cancer sciences. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible. So friends, hopefully today's discussion was helpful to you and आपको जरूरी कुछ नया इंफॉर्मेशन मिला होगा. आपके मन में जो भी क्वेश्चंस है वो कमेंट सेक्शन में जरूर बताइए. So here is your friend Dr. ARGHYA BASU, gastro and cancer surgeon, signing off for today. We will meet in our next video very soon. Till then, take care, bye bye and Jai Hind.